All right, welcome everybody. So we were thrilled to have you here today with the Illinois Higher Education Center. Today we are, so excited to have Dr. Dolores Cimini with us here today, who's going to be delivering a presentation on implementing and sustaining a comprehensive AOD prevention program in response to a changing higher education landscape. So we are asking that you would keep yourselves muted. We'll have a time for questions at the end, and you can also utilize the chat box as needed, and I will kind of moderate that to make sure, we're not missing anything as well. For those of you who are requesting CE credits, I will be sending a post email, or it'll be from GoToWebinar. And that way it'll have you fill out a survey, and then that way you can get the certificate for your CEU. Looks like we've got a decent amount of people on here. So without further ado, I'm going to introduce Dr. Dolores Cimini and transfer it to her. She has been known for her work at the Center for Behavioral Health Promotion and Applied Research at the University of Albany. She has worked previously with SAMHSA and other organizations as well. So we are thrilled to have her here today with us. Take it away, Dr. Cimini.
Thank you so much. I am so pleased to be presenting for IHEC today. It's a wonderful organization. I've been following it for a number of years. And of course, Eric is a wonderful colleague of mine, very much an expert on many things, particularly the biennial review. So I'm honored to be presenting today. So if you could please, Annabelle, open up the slide presentation, I can get started.
All right,
Thank you so much. Okay, I see the presentation. So I work at a large public university in the northeastern United States, and like all higher education institutions around the country, during the past years have faced a lot of challenges with students coming in with more and more complex substance use and related mental health issues. And then, of course, relating to the challenges associated with COVID-19 and more recently the opioid crisis, our work has become a lot more challenging, both on our own campus and I'm sure on your campuses nationally. What I found that I've had to do is really take the knowledge from the evidence-based strategies that I've learned about and that I've worked in for so many years and begin to think differently about those evidence-based strategies and retool what I've learned to adapt to the increasing challenges in higher education that we're all facing. So today, what I'd like to do is several things. First of all, to give you a sense of our own journey at the University at Albany for the past 2 decades that we've undertaken around alcohol and substance use prevention. You'll be learning about what our campus is like, what models we've been using, and then I'm going to be shifting into the 2 challenges that we have had to deal with in recent past, the COVID-19 pandemic, and more recently, the opioid crisis, and how we've adapted the models that we've developed at the University at Albany to be more nimble about addressing these new challenges and hopefully leaving you with some nuggets at the very, very end should we face some additional challenges and twists along our journeys, that there are some things that we can rely on that will take us through many challenges that we may encounter in the future. So let's go to the next slide. And we'll start with looking at some of the recent data. In fact, and on the next slide, we'll see some data from Monitoring the Future. This data is probably not unfamiliar to you. It's from the most recent survey of high school students and incoming college students. So we see a continuing concern around cannabis use, tobacco use, and vaping among our college students. And if we go to the next slide, we have some data on alcohol use. Alcohol use continues to be the #1 issue that faces our college students with regard to substance use. In addition to that, binge drinking continues to be a problem. And of late, there are increasing issues around high intensity drinking, and that is 8 to 10 drinks at a sitting that students are engaging in. And so that's really a new challenge for us. And of course, what we're monitoring right now as a nation and as our campus is the results of the COVID-19 pandemic and the use of opioids, the increasing opioid crisis. Comparatively speaking, and fortunately, opioid use is not as prevalent as is alcohol use or cannabis use on college campuses, but it's something to be cognizant of, because any excess use of an opioid can be potentially deadly very, very quickly. Next slide, please. So what I'd like to do now is to talk about our journey at the University at Albany. Next slide. So the University at Albany is a large public university in the northeastern United States. It's one of the 64 State University of New York campuses, and it's one of the 4 research centers within the State University of New York system. It's located in the capital of New York State, which means for good or for bad, we are highly scrutinized. We're a campus that is mid-size, about 18,000 students, 13,000 of which are undergraduates, and the rest are graduate students. We are primarily a residential campus with about 7,000 to 8,000 students living on campus. And we are also a Division I campus. We are, as I mentioned, a Research I university. And because we're located in the Northeast, we fit into a number of risk factors for high-risk drinking and drug use. So it's always on our minds. In fact, both in 1999 and 2004, the University at Albany had the dubious distinction of being designated as the #1 party school both times on the Princeton Review. Again, a dubious designation, not really based on a strong survey technique, but perception is 9/10 of the issue here for individuals that don't know how to interpret surveys or how to analyze good surveys. So what was happening to us in the late 1990s and early 2000s was that students were coming in to large extent because they wanted a school where they could have fun, where they could party. And anecdotally, it was our sense that we were seeing more and more students with alcohol and drug issues coming to the University at Albany. So we had a big problem in the early 2000s, and we needed to address it very, very quickly. And what we relied on is what at that time was the NIAAA Task Force on College Drinking and its work. And in 2002, that's when the landmark report on college drinking came out from the NIAAA. And of course, we know that what that report did is it gave us guidance on what worked and what didn't in addressing alcohol use. It divided effectiveness of interventions into several levels, the most effective being interventions being evidence-based and being individual in nature. There were also some promising evidence-based strategies that were applied to campuses and broader communities, such as environmental management strategies. And of course, social norms came up to be a very promising strategy based on the NIAAA report. So we developed, as a result, if we can go to the next slide, a comprehensive public health framework. Okay, let's see. Okay, actually, this is just a snapshot before I talk to you about our framework. This was a pictorial representation of our a riot that we had around St. Patrick's Day in 2011 called Kegs and Eggs. I think some other campuses have similar types of events, but this one was very, very dramatic for us. It really caused very significant problems in terms of university and campus relations and that type of thing. So this is just an example of some of the challenges that we've been facing. Now, next slide, we'll begin to talk about what we tried to do about it. Okay, we're going to be, oh, we can pass this, okay, there we go. All right, so what we learned from the NIAAA report and from other research that was going on in the early 2000s was that the best way to address alcohol and substance use was with a comprehensive program, and that addressed the entire campus community, that engaged in early intervention activities for individuals who are developing problems, and then indicated interventions such as treatment and referral to cover the whole gamut of students and their needs. And of course, we can't forget our students in recovery, and our interventions for our students in recovery cut across all of this, because students in recovery could be at any place on this triangle, depending on where they are as individuals. So, as we know, universal interventions affect the entire population. They help and support the entire population, and they promote health. Examples of those are social norms interventions, educational interventions, and health communication campaigns. Early interventions are interventions that specifically target students at risk for substance use. And they, of course, based on the literature, include fraternities and sororities, student athletes, students coming in to health and counseling centers for problems unrelated to identified substance use, first-year students, student veterans, and international students. And so some of the interventions that we engage in the early intervention space are screening, brief intervention, and referral to treatment. That is, engaging these target populations in relevant and responsive ways to do brief screenings, and then using motivational interviewing, brief interventions to address their use. And so we're catching students early in that way before they develop problems. Now, treatment and referral, we have counseling, we have referrals to substance use treatment, we have consultation, we have a variety of different types of interventions. And if you look at the expenditures of resources as it relates to this particular triangle, we tend as higher education institutions to put in the most resources and funding on the right side of the triangle. We're helping the fewest number of students in that way. Now, I'm not saying it's not important, it's very important. But what we want to do in our prevention strategies is to move upstream more to the left of the triangle so that we're reaching more students before problems develop. And also, of course, continue to provide the counseling and other vital services that are needed for students that have already established problems. So here you see some examples of our comprehensive program elements. And we have been delivering these for the past 23 years. Next slide. All right, and here's another way to slice our prevention program. As you know, it takes a village. We know that, to address substance use on campus and in the community. It's not a one person or one office job. So here, and you've probably seen this before, it's from the Higher Education Center on Alcohol and Other Drug Prevention from the U.S. Department of Education. This came out at about 2009, 2010. It lists some of the essential elements for our comprehensive prevention program. Of course, we need presidential leadership, we need task forces, we need student engagement, campus community coalitions, and on and on and on. And we have all of these on our campus, and I'm sure many of you do have most of these as well. It's important to keep all of these active when we implement a comprehensive program, and we've been doing that also for the last 23 years. Next slide, please. All right, and this is probably also familiar to you, the Strategic Prevention Framework. We use that. First, we have assessment. We assess through data and other sources, surveys and the like, on an annual basis, how we're doing in terms of substance use and related risk prevention. We monitor our capacity building. We engage in planning and implementation and evaluation. And as you know, this is not a linear start and end process. It goes back and forth. It's, you know, it's constantly changing. It's constantly evolving, and so we espouse this process in our campus. Next slide, please. We have also a focus on harm reduction. Initially, there was very much a push on abstinence, as we know, in the 1980s and 1990s on many campuses, but we know that telling students not to drink or use substances does not work. What we want to do is to talk about reducing harms and ultimately giving our students the choice regarding their use. And by and large, what they're going to do is choose the healthier options. Next slide, please. All right, I'm going to show you now some examples of what we've done in the universal and early intervention spaces for our campus. This is a recent poster addressing alcohol use, and I'm sure all of you know how social norms works. We present data to students through media campaigns and the like that support the health of the majority of our students without giving any messaging as to what students need to do. And then we will, we trust then that the students will engage in healthier behavior and choose healthier options. And in fact, we've been doing social norms campaigns since 2004, and we've been noticing significant trends toward reduction of alcohol use and still reductions in cannabis use, despite the fact that cannabis has been legalized recently in the state of New York. Now, the interesting thing that our students have been talking to us about recently in focus groups around our social norms campaigns is that they actually want some suggestions regarding what to do to reduce their risks, to reduce their harms. So we're thinking, wait, this doesn't go along well with social norms, so how are we going to do this? And so what we decided to do is to keep the social norms posters, such as this one, distinct, but then also put alongside it, if we can go to the next slide, some information on tips to reduce risks for alcohol use or whatever use the poster is talking about. So we would have the poster that you just saw in the last slide right to the left of this one. They would be next to each other. So in our view, then, we're not dismantling the social norms theory. We're giving the information to the students that want to look at it. And then for those that want the tips, right next to the poster, they can see if they want to look at it, the tips around reduction of risk. And this has been working very, very well for us the last few years since we started it. Next slide will show you a social norms message around cannabis. If we can go to the next one. There we go. Okay, so this is our cannabis poster. We were one of the first campuses, I believe, in the US that started doing messaging around cannabis, probably when it wasn't the norm, so to speak. And we were finding that it was very, very effective, noticing trends on reduction of cannabis use. And then if we go to the next slide, we can see the accompanying poster with the tips on reduction of risk. Again, the cannabis poster with the stats would be on the left, and this poster would be placed right next to it on the right. And we would do the same when we place these messaging elements on social media. They always went together. But you know, for in the eyes of students, they could be seen as separate entities, or they can be seen as combined, and were responsive to the newer needs that the students were identifying in our focus groups. Next slide. So then we were thinking, how could we integrate early intervention into the work that we did? Okay, so we've addressed our population level needs through the messaging that we have been doing. But what we wanted to do as well is to give as many students as possible the opportunity to be screened for alcohol use and cannabis use. And so we developed a process that we are implementing through social media, where students would go on Instagram, see a series of messages, and then as part of the Instagram message, there would be a way that students then could link to a screener for alcohol use and or cannabis use respectively. They would go to the screener, they would take it anonymously, and then they would get personalized feedback through their social media device or contact, which would give them recommendations as to what to do next. So for example, with this particular social media post, we linked it to the alcohol use disorders identification test by the World Health Organization. I'm sure you all know of that particular measure. Students would interact with this Instagram post, go to the audit on a site that we have. They would complete the audit, and then they would, based on the zones of the different scores that they fell into, would get feedback. If those that were engaging in abstinence or lowest risk drinking would get a message saying, you know, keep up the good work, that type of thing. You know, you're engaging in low risk behaviors, that's good, you know, that type of thing. We wrote it in a language that students can understand. For students that were scoring as high risk alcohol users, they were referred to the campus counseling center and other resources. So this was also very effective. Next slide, and you can see with the next slide, we have the cannabis Instagram post, and the same thing. This Instagram post was linked to the QDIT-R, the Cannabis Use Disorders Identification Test Revised. And we were finding that quite a few students were engaging through social media posts with these screeners. And we also saw an uptick in students coming in for follow-up services. Next slide, please. Another strategy that we used related to both the prevention messaging that you saw and the links to the screeners is that we partnered with our local bus company who controls the bus shelter advertising in our local community. And we paid for advertising to appear on bus shelters on campus, on bus stops near our campus. So as students were waiting for their buses, they would be reading information on tips to reduce their risk for a variety of substances. And it's probably hard to see on this poster, but at the bottom of the poster, there is a QR code to the respective screeners I talked about. So if a cannabis poster was on the bus stop, a student would be linked to the QDIT, and they could take that screener while they were waiting for the bus. And for alcohol-related messaging, we connected the QR code to the audit. And the first day that we put out these large posters at bus shelters, the number of screeners that we got were 144, which was very, very impressive for us to see. We didn't know how this would work, and it worked really, really well for us. So that's very, that was a quite a pleasant surprise, and we still to this day use this intervention. It's a natural intervention. It's one that reaches a lot of students because we have a lot of bus riders that come to and from our campus. Next slide, please. So those were some of the interventions that we engaged in prior to the twist and turn that was provided through the COVID-19 pandemic for our university and actually for our nation and the world. And what I'd like to do now is talk a bit about how the COVID-19 pandemic has kind of restructured our thinking about some of the interventions that we've done and how we've implemented and adapted some evidence-based interventions to adapt to that period of time. If we go to the next slide, we see some links to a variety of newspaper stories and pieces that were telling us that shortly after the COVID-19 pandemic started, this was in spring 2020, there were a number of parties occurring around college campuses, including our own campus. One of the articles is about our own campus, where students, despite public health guidelines talking about social distancing and the like, students were partying and being in contact with each other, and associated with that, there was an increase in COVID transmission. So if we go to the next slide, I was curious at that point in time about whether those students who engaged in a higher amount of alcohol use, that is, students engaging in heavy episodic drinking, were more likely to engage in COVID-19 transmission, higher COVID-19 transmission. And then also the other question that I had is whether students who were higher risk drinkers, that is heavy episodic drinkers, had attitudes such that they felt that, they didn't really care about following public health guidelines, and they didn't really feel a responsibility to follow public health guidelines. And in fact, we had the opportunity to look at data that we already had. We had just finished a survey prior to the pandemic, our annual survey on alcohol and drug use. And then, because nobody was really doing surveys at the beginning of COVID-19, we got approval to administer a survey to all of our students, asking questions about COVID-19, adherence to public health guidelines, and attitudes around COVID-19. So we had a great opportunity to compare pre-COVID to COVID data around alcohol and cannabis use and other drug use, and looked at whether there was more transmission among the students engaging in heavy episodic drinking. So the next few slides, and we'll go through them relatively quickly, will show you that in fact the hypotheses were born to be true or validated. So as you might guess, compared to prior to the COVID-19 pandemic, when students were locked down, they engaged in less alcohol use than before that. And then you probably would guess as to why that is, because they're probably living with their parents and their families and don't have as much access to alcohol or cannabis. But, we did that was borne out. So if we just keep going through the slides here, next slide. This is another snapshot of basically the same pattern. Go to the next slide. We have similar patterns on cannabis use before and during lockdown. And then the next slide, we have, we begin to look at the student agreement with COVID-19 guidelines. So what we did here is we divided students into different groups depending on the amount of alcohol use they engaged in. And sure enough, we began to see some trends around student attitudes around following COVID-19 guidelines, and those engaging in higher alcohol use were less likely to feel that they should be following public health guidelines. So these are different public health guidelines at the bottom of the sets of data, and then you can see the patterns. If we go to the next slide, we have more of the guidelines, and we see similar patterns, you know, things like mask wearing, et cetera, et cetera. This was fascinating to us. If we go to the next slide, we actually have students reporting how much they were following public health guidelines. We see the same pattern. The students engaging in more heavy episodic drinking were engaging to less of an extent with public health guidelines. And if we go to one more slide, we see again a similar pattern. Okay, so some of these were certainly trends in that direction, but some were statistically significant. And so this really concerned us. And if we go to the next slide, what we did immediately was that we recommended to our Vice President for Student Affairs a strategy to address this, because we saw this as a very serious problem. There was clearly a connection between alcohol and cannabis use and transmission of COVID-19, or a risk of that. And so I proposed that we start a COVID-19 and AOD work group, where those most involved in alcohol and other drug prevention work on our campus met on a weekly basis to monitor the situation and to work with what we knew around evidence-based strategies to develop responsive strategies to the COVID-19 pandemic. So here you see our 3 C's, and this was our mantra. So it meant comprehensiveness, that is working with a comprehensive program structure using a public health framework, and taking some knowledge about what we knew around HIV and other types of transmission, and how would we work in the AOD space from the knowledge that we learned from that. Collaboration, of course, we needed lots of hands involved here to work effectively with this process. And then thirdly, compassion. The initial instinct of our university to address the COVID-19 pandemic and the partying that was happening associated with it was to punish students, to suspend them, to remove them from the university, to disenroll them. And so we recommended a different strategy, and that would be to use compassion. We talked about the importance of understanding brain development in our students ages 16 to 25, indicating that the brain is still developing in these students, and there was a tendency to, during this period of development, to engage in increased risk behaviors. So we recommended strategies in which we would educate students and also give them tools to reduce their risk. And our university very much appreciated these recommendations and encouraged us to follow them. So next slide. Here on the next slide is an example of one of the many diagrams we created to address particular issues or high-risk periods during the academic year. For us, it was Halloween, the beginning of the fall and spring semesters, and St. Patrick's Day. So, this had what we were going to do, who was going to do it, deadlines, et cetera, et cetera. So we had a very, very structured approach, which worked very well for us. And on the next slide, you begin to see some examples of different strategies that we use. So we used our campus community ambassadors to go out in the neighborhoods where some of the partying was taking place, and we had them put together some gift bags with educational materials, with masks, and also with hand sanitizer. To be given not only to our students door to door, but also our long-term neighbors, because we felt the responsibility to protect them. In terms of the educational materials that we distributed, what we focused on is to take what we learned from the HIV epidemic, the early stages of that epidemic, and looked at how they addressed that. For example, what was being done for HIV transmission prevention, use of condoms, use of medications, use of methods that decrease risk, as well as providing education around safer sex and the like. And so we created some different handouts. If we go to the next slide, and you'll see some of them. So, talking about COVID with your partner, COVID and AOD use and the like. And we created a Halloween framework we did a series with our series of educational interventions, and we got lots of feedback that students were actually reading these. We posted them to social media. We sent blast emails out with links to these materials. We gave them out to students, put them in the gifts bags, as I mentioned. And if we go to the next slide, you see that if we go to the next slide, if we can, you see that essentially we see the same content, but we changed the theme to St. Patrick's Day. In March 2021, we were very concerned about St. Patrick's Day coming up in our community was as well, because it was the 10-year anniversary of our Kegs and Eggs riots. And the community was saying, oh, there are going to be riots again and that type of thing. So our AOD and COVID-19 committee put together a plan. We engaged lots of partners. We put out this educational material. And there was not one serious incident during St. Patrick's Day weekend in March 2021. And so we felt that as an achievement, that our evidence-based strategies indeed that we adapted were effective. Next slide, please. And again, we use these bus shelter ads to provide education to our students during this time. We continued this. Next slide, please. All right, so that's how we adapted information for COVID-19. Then, as we were returning in person more and more on our campus, another challenge came to us. And if we go to the next slide, that challenge was in large part associated with the opioid epidemic. I remember the date on September 4th, 2021, the Drug Enforcement Administration, and I understand that you recently heard from Rich Lucy about this. The Drug Enforcement Administration released an advisory to the public about substances laced with fentanyl, that people could be buying drugs like Adderall, stimulants, other types of drugs on the internet, and they could be inadvertently laced with fentanyl, and they could be deadly. And so we got our COVID and AOD group working on this new challenge, and we looked at what the evidence-based strategies were and developed a plan to address this. Well, actually, let me take a step back. Before we began to address this, I made another appointment with our Vice President for Student Affairs and said, we have another serious issue going on. And it just so happened that the weekend before I met with our Vice President for Student Affairs, there were 3 opioid overdose reversals in the neighborhood that our students were living in. In one case, one of our partners in our COVID and AOD group that was trained in administration of naloxone was doing a community walk, and he was carrying Narcan, and he actually did the rescue. And if he were not there, a student of ours would have died. So this and this is something that actually came up in that meeting and added to the strength of the case I was making, that this was an issue and that we needed to address opioid use. In addition, we were beginning to see uptakes in alcohol and drug use as students were coming back. Our students in recovery were beginning to get concerned about these issues and the like. So a whole set of different things as students were coming back in person were happening that we needed to keep our eyes on. So what we did is we developed a very strong and intensive media campaign, and you'll see on the next few slides what the campaign entailed. Okay, so we created some homegrown university posters focused on harm reduction regarding opioid use. And we put these on social media. We posted these around campus. We sent out emails. We worked with student groups. Okay, so very much a public health informed universal intervention. Next slide, please. And then here you see some of our Instagram posts. I'm not surprised if Rich may have shown these to you in his presentation. So we'll just move forward, and you can see the next. There's going to be a series of these, yeah. So and here's another social media element. Next slide, please. Okay. Yeah. So these are okay. It's okay. And here, another thing that we did as well, and this is happening now annually at our university, is we put together an opioid awareness week. And this happens in March/April of every academic year. And as this, so this is hard to see. I'm happy to follow up and email anything that would be helpful to any of you around this, but this includes programs on Narcan training, some programs for students in recovery, there's a program on how to use fentanyl test strips, so and some programs on harm reduction around opioid use and how to help a friend who may be using alcohol or drugs to excess. So this is something that we do on a regular basis. Our students come to these programs, engage with them, and are very, very aware of the impact of opioid use on our campus and nationally. Next slide, please. Okay. Now, another opportunity or twist of fate that we had recently, and this also happened in spring of 2021, is that we saw a need to engage, especially around opioid misuse prevention, with our students experiencing the most health disparities. So our students of color, our students coming from the New York City area and 5 boroughs of the city, they were coming in to our campus from areas very, very severely affected by the opioid use epidemic. And so we also then at that point received a grant to start a program called Project Access, which stands for Achieving College Completion Through Engaged Support Services. We're not going to connect to the link here about the video about the program. I'll tell you briefly what it is. So our students who are most economically and academically disadvantaged who are coming to UAlbany, come into the university the summer prior to their first year, and they engage in an intensive academic program to build up their math skills, their English skills, their writing skills, etc. So we proposed that might we come in and place what we call prevention navigators in that space, in that intensive program, and provide each of the 120 plus students coming into Project Access with comprehensive well-being assessments. So asking about their substance use, their mental health, their risk for HIV, all kinds of risk behaviors, and then provide them with timely and responsive referrals to different services. And so the university was very excited about the idea, and we started Project Access and have been intervening with our students from our most disadvantaged backgrounds, engaging in individual and prevention, navigation, and education. Next slide, please. So we have here a slide showing how people who identify as Black and African American, people coming from areas where there are lots of health disparities, are at highest risk for engaging in opioid use. This was out of a report from the CDC last year. And next slide. So what the best response for individuals experiencing health disparities in dealing with the opioid crisis is to provide them with different pieces of support. And you see here the puzzle pieces. And so that's exactly what our navigators have been doing. Our navigators, by the way, are students with lived experience with substance use and HIV and mental health, who we train in motivational interviewing, and they're doing the well-being assessments and providing to their fellow students the timely and responsive referrals. Okay, next slide. One of the things that we did as well with Project Access with the students is that we gave them Narcan training. And I was very impressed, but not surprised though as well, by the knowledge that these students had about Narcan, what it was, about the opioid epidemic. And many of them asked for not one, but 2 naloxone kits to take with them back to their home communities so that they could help others. Sadly, we also learned as part of this training that one of the new students coming in had their mother sadly die of an opioid overdose 2 weeks prior to the students coming into the program. How sad it must have been for that student to have access to the reversal drug after their mother passed away. That was just heartbreaking for us. But also shows how much this is needed, and hopefully future tragedies would be prevented by our young students being trained. Next slide, please. Okay, and this is just some other type of material, showing you some of the things that we gave out to our students in the educational opportunity program through Project Access. Next slide, please. So as you have seen, all of us certainly have spent a lot of time being trained in evidence-based strategies. We know the importance of comprehensive programs. We know the importance of a comprehensive public health framework in doing the work that we do. And that has not failed us at the University at Albany when we were dealing with the twists and turns presented to us by the COVID-19 pandemic and the opioid use epidemic. And in fact, on the next few slides, if we go to the next slide, some of the strategies that we know of to promote and support comprehensive programs following evidence-based and evidence-informed strategies are what we need to be able to continue to implement as we as we do our work. If we rely on our knowledge and our experience, no matter what the twists and turns that are presented to us, we can move forward. These keys to effective prevention that you see in front of you are from a report that was written in 2010, I believe, where a number of colleagues, professionals were interviewed who had model alcohol and other drug prevention programs. The report was entitled Experiences in Field Experiences in Prevention. Next slide, please. Okay. So here talks about where do I begin, and these are also things that you want to build collaborations, you want to engage, you want to be seen as the expert. Next slide, please. And here we have also some strategies for success. To move forward, an effectiveness. Yes, there we go. Okay. We engaging with the campus community, especially engaging with students. We need them at the table, as we know, in order to build and sustain our evidence-based program. Engaging with administrators and also engaging with our community. These things are especially important when we have unexpected issues happen on our campuses, in our communities, and nationally. Next slide, please. And then here we have to be successful. It's important to be nimble. That's number one. In response to the COVID-19 pandemic and the challenges of the opioid epidemic, we need to be nimble. We need to know what our evidence-based practices guide us to do, but we also need to not be afraid to try new things and to document what we're doing and to always evaluate the effectiveness of what we're doing. And please, I would also add, as a researcher and as a faculty member now in my new position, please publish and write about your successes. That's how we learn. And I am thrilled when I hear about new strategies that colleagues develop. Be persistent. Establish a sustainability plan. We're not going to be in our positions forever. So document what you're doing and talk about how, with colleagues and with your administrators about how your good work is going to continue. That's really very, very critical. And then my last slide, I believe, is some helpful resources. Yeah, and I'm providing here, and you've probably seen these before. This information is from the Drug Enforcement Administration. Since we're focusing on addressing the opioid epidemic and the strategic prevention framework and evidence-based practices, I always try and talk about these resources. I think they're very, very helpful. So definitely take a look at these. And then the next slide is one in which I encourage you to invite questions, and maybe what we can do is go to my last slide, which has my contact info. If there's any information in this presentation that you find helpful or that you want copies of, please feel free to reach out to me. I'm happy to share the information, and I really think the only way that we can move forward as a field is for us as colleagues to share what we've developed and our successes, and of course our failures too, because we learn from those with each other. So thank you for listening to me, and thank you, Annabelle, for your support in putting together this webinar.
All right, thank you for that wonderful presentation and all the information you have to share with us. For anybody that would like to ask any questions, you are welcome to start at any time or put them in the chat as well. Doesn't look like I'm seeing any questions. That is all right. Okay, well, if we don't have any questions, I am good to dismiss everyone. We want to thank you for coming today. Be on the lookout for an email from either IHEC, GoToWebinar as a follow-up. And if you have any questions, she is always available to answer any questions, and I will also have her contact information as well if you would need it. Anything else you'd like to add?
Thank you so much. Thanks everyone for coming.
You're welcome.